Hi, my name is Diane Xin. Today I'm going to talk about the sexual body in health and illness. First, let's talk about alcohol, drug, and sexuality. We all know that alcohol use among young adults aged 18 to 24 is very common. More than 1 in 10 young adults are heavy drinker. Almost 2 in 5 are binge drinker. According to the article by Hunter P., 70 to 80% of college sexual assaults involved by alcohol. The alcohol effect on both men and women. For men, they're having difficulty achieving or maintaining an erection. Another effect is if men drinking 6 packs of beer less than 2 hours, it affects on testosterone and sperm production. It does not mean that there are no sperm on their body, just production is really slow. For women, they will experience dryness in vagina. For both men and women, alcohol could be contributed to infertility and birth defects. Also, alcohol use can cause of sexual violence and sexual intercourse. There is other issue which is drug use. Aphrodisiac, which means that to improve sexual function by drug and medicine. Most common drug is marijuana, which increases stimulation and sensation that people feel high and happy, but long-term user can contribute to low motivation to achieve and low sex drive. Next is amyl nitrate, it called as popper. The drug causes engorgement of the blood vessel in the penis, vagina, and anus. That makes dizziness because it drops in blood pressure. Cocaine leads to sexual function difficulty in both men and women, as well as orgasm and erection. Ecstasy have been associated with dehydration due to physical exertion without break for water, which can occur to heart attack or liver damage. Because users feel increased empathy, ecstasy can lower sex inhibition. Next, let's talk about sexuality and disability. There are physical limitation and changing expectation. The major problem people with disability overcoming and anger or disappointment they feel because their body don't meet the cultural ideal, and they have a rich fantasy about sexual activity. There are chronic illness. First is diabetes. Diabetes usually more affect on men. Men experience problem with sexual desire, difficulty achieving an erection, and not experience orgasm. Women has less interested in being sexual activity since they easily feel tired. Cardiovascular disease is heart attack or stroke. If they want to do sex activity, they must be counseling with their doctor. Athletes having pain in their joint so that they feel pain if they have a sexual activity. Lastly, let's talk about sexuality and cancel. I categorized into 3, women, men, and both. This slide shows what kind of cancel usually taken by gender. Let's quickly talk about breast cancer and prostate cancer, which are most common cancer among men and women. Breast cancer developing a solid tumor that involves her breast tissue. There are other factors increase the risk of breast cancer, such as alcohol use and environmental pollution, which means that breast cancer influences not only genetic region but also outside environmental region as well. Prostate cancer is more common in North America and Northwestern Europe. The risk factors are aging, of family history, being African American. However, researchers still study for why African Americans have high potential on prostate cancer. Thank you for listening to my presentation. I hope you guys learned from my presentation. Thank you.